Hi, my name is Avinash Shanbhag. I work at Office of National Coordinator for Health IT and serve as the Executive Director for the Office of Technology. And I am super excited to be participating in this workshop on EHRs because as you see from the title, EHRs are what my office does, and we are so excited to be part of this workshop talking about the work that we do and also some of the things that we are interested in making sure there is innovation is happening in that industry. So what I will do is I'll begin with a brief introduction of my office to just kind of make sure you all know where ONC's work interfaces with electronic health records technology and our interest in EHRs. Then I'll focus a lot on interoperability because that's some of the area that we are explicitly interested, but also we see it as one of the foundational things that will help innovation in health IT. So we'll talk about some of the cool things that are happening in ONC from a regulatory perspective and also on our coordination with different agencies. And then I will touch on some of the innovative work that we are doing to advance health IT to make sure that health IT and EHRs in particular are able to meet the needs of the various domains that are really interested in using the technology, especially like with oncology as the primary focus for this session. And again, I'm honored to be part of this panel with other illustrious federal agency participants to talk about our interests and how our work interfaces with other activities happening in the federal agencies. So briefly, our office, the Office of National Coordinator for Health IT, ONC, was founded in 2004 by an executive order established in statute in 2009. And really, the foundation of our work is the HITECH Act. And again, I was told to spell out the acronyms. So HITECH stands for the Health Information Technology for Economic and Clinical Health Act. And really, as you can see, as a foundation, our role was to ensure that EHRs have the capabilities to be used and leveraged by providers, docs, and hospitals to support the desire for electronic health information exchange. And again, there was a lot of funds that were invested, over $40 billion invested in to subsidize EHRs. And really, our work has been in certifying these EHRs, which I'll describe in a little bit, to help you understand where we fit in. And again, our work has now transcended to the 21st Century Cures Act, which was established in law in 2016. And really the value of that work is now to leverage all that information, leverage the technology that has been built and supported over the last several years into ensuring that really EHRs are supporting the cool new things that we all want to do. And to again briefly kind of talk about ONC's certification program, the reason why we exist is to ensure that EHRs are certified. So that's one of our main focus areas. And as I mentioned here, over 96% of hospitals and ambulatory physicians, over 90% of ambulatory physicians are using EHRs that are certified by ONC. So again, when we talk of certification, we talk about some of the requirements that are in EHRs to support the base requirements of those technology. And really, there are some of the foundational technologies that can now be used to build upon to come up with newer usages. Broadly, the areas where ONC's work really focuses on are in three areas. Standards, just because, again, these are some of the foundational things that we know will help industry agencies to innovate on. So we focus a lot of our attention on standards. Certification is a key area where we ensure that the technology meets the base needs of the healthcare sector. And really, we work with federal, state, local agencies to make sure that policy also comes along with it. So technology policy go hand in hand to ensure that, again, in ONC's objectives, we want to make sure that health IT is used to advance healthcare and health information exchange. The key areas where we focus our attention through both of regulatory activities and through our standards activities is interoperability. And again, just at a high level, the way we divided interoperability is data. As you all imagine, data is at the core. Healthcare information is is very complicated and semantics is critical. So as part of our regulatory activities and certifying EHR, we have established what we call as the United States Core Data for Interoperability. And at a high level, you can think of USCDI, the acronym for United States Core Data for Interoperability, as the basic minimum data set of a healthcare delivery system. So basically, you can think of this as these data elements that you see here are going to be exchanged, captured, stored, exchanged by all certified EHR technologies. And the great thing is this, we have established a process by which this data set grows in a public process, public transparent manner year by year. So again, the idea here is that this minimum set grows and will evolve to expand to be leveraged across the various spectrums. I'm very excited about that. Now, we all know that data per se, it's not sufficient. So we also, because data needs to be then exchanged in a consistent manner. So again, as part of one nuance I wanted to mention is, as part of the regulations, we also established some of the standards way by which that data can be exchanged in a way that makes it easy for third-party application developers for other usage of that data. And again, one of the things that we have worked and are part of the regulations is this application programming interface requirements in EHRs that enable in a very easy manner for providers to be able to access the data in EHRs. And also, as along with the technology, we also have the appropriate behaviors as part of the conditions and maintenance certification behaviors on certified health IT developers to make sure that they are being leveraged very easily. Finally, I won't talk labor on it, but you can imagine with healthcare, you have the data, you have the standards. There are lots of health information networks. We all have, and there are disparate networks that have different trust environment. We have recently, in January, released what we call the Trusted Exchange Framework Common Agreement, TEFCA. And again, think of it as a nationwide standard governance process to make sure that these networks can easily talk to each other. Think something similar to how AT&T and Sprint could talk to each other so that customers don't have to basically switch or have different phones to be able to talk to somebody on a different network. So this is something very exciting and something, again, can be leveraged by industry, by agencies for their own benefit. So now I'm going to move a little bit to innovation. Again, this is very rapid. I just wanted to touch a little bit on some of the work we have been doing, which is non-regulatory, but again, in the interest of ensuring that health IT and again, EHRs are leveraged for things that are focused and needs for the industry. So one of the things I wanted to highlight was our work that has been going on for the longest period of time. Since 2016, we have been working with our federal agency colleagues at CDC to develop clinical decision support standards that really are aligned and integrated with EHRs so that EHR data can be leveraged to take electronic decision support. And we're very excited about it because, again, this is where some of the benefits of just digitizing the health information can really come to life. And again, I'll note that we recently had the pleasure of working with the President's Cancer Panel to kind of describe some of the work that has gone into clinical decision support and make sure that that information we are very excited to see that information did get into the report that was published recently by the White House President's Cancer Panel. So again, just to recap in the 30 seconds that I have, I again want to leave you all with the knowledge that with EHRs, ONC's role is to ensure that EHRs, through our certification program, provide the level of conformance that all the participants that use EHRs can leverage and can trust. So this is a stable basis foundation along with the technology, the functional requirements that we hope and want industry to take to leverage and use. We are focused on interoperability because we think interoperability provides that foundational highway, data standards, network interoperability on which innovation can happen. And finally, we are excited to work with agencies across industry to support innovative uses of health IT and EHR is near and dear to us. So thank you very much for again, hosting this workshop, and really excited to be part of the panel that's here. So thank you again and hopefully, we can provide any information that you all need to make sure that you are able to leverage the technology and the health information as is envisioned in our work. Thank you.